Some of these things are as a result of not knowing what to do and when to do it. But today we are blessed to be having a servant of God whom God has sent to us today to talk to us about the topic cancer in children. And this is none other than Dr. Atwine Barnabas, a childhood counselor and blood specialist who works at Mbarara Regional Referral Hospital. Ladies and gentlemen, may you put your digital hands together and welcome Dr. Atwine to speak to us. Doctor, you are welcome.
Thank you very much, Uncle Bob, for your kind introduction, and thank you for asking me to talk about this, which I really love talking about so much. I don't know if you'd like me to share. I have prepared a few slides so as to guide the conversations. I don't know if you'd like me to.
Sure. Go ahead and share.
Okay. So I hope you can see my slides, right?
Yeah, the screen is trying to start sharing. They have not come on, but yeah, we can see them now.
Good. Thank you so much. Let me just. Okay. All right. So I'm called Dr. Barnabas Atwine, and I won't spend the time to introduce myself because I have already been well introduced. I am a childhood blood and cancer specialist. I head the childhood cancer service at the hospital in Mbarara, and I also teach in the Department of Pediatrics in Mbarara University. When I'm not in the hospital, I am married to Sarah now for more than 10 years, actually. I'm a father of 4 children. That's an old picture. These ones are much bigger now. I couldn't get a more recent picture so fast. My home is in Nyamiko, in Bushenyi, in Western Kole Diocese. But now I currently, because I stay in Mbarara and teach in the university, I currently fellowship in St. Luke's Chapel at Mass, and by the grace of God, I serve as the head of laity there. And today we're just going to talk about cancer in children, just to give an overview. Really, it's not like a lecture, honestly. It's a very simple overview of it. But I thought we just want to know what cancer is and describe how it develops in the body, and list how children, when they have cancer, how they look like, and maybe just talk about how we can get involved in the care of the children with cancer ourselves. So cancer is not one disease. It is not one disease. It's a group of many related diseases. So, but all these diseases basically have a common feature of having cells growing outside the control of the body. So if you remember cells, before you dropped biology, I'm joking about that, but remember cells are the bricks or the blocks of the body. The house you're sitting in right now is made of blocks or bricks, and those are the cells of the body. So all our bodies are made up of small, very, very tiny bricks or blocks called cells. And these cells are supposed to grow in a certain way under strict control, really, really under strict control. But so many times there are some problems that happen. It's called a mistake. It's a mistake that happens. In English, in medicine, it's called a mutation. It happens, and these cells grow, become fundamentally different. One or two cells change because of this mistake that happens in the cell division. If you remember cell division, again, there's a mistake that happens that fundamentally changes the structure, the behavior, and everything about a cell. Now, what brings about that change is really not something that is outside the scope of this lecture. But something happens and the cell fundamentally changes and starts behaving so differently. But one of the things that is different is it starts growing like in a way that is totally different. It's totally not under the control of the rest of the body. So it's like having a wayward child at home. If a child becomes so wayward, is not listening to the parents anymore, is running out of home, that is really what cancer looks like. And as you can imagine, what happens, the child who is wayward, he affects everyone, the parents, the siblings, the neighbors, everyone that is concerned about this child gets really, really affected because of their waywardness. So also, this cancer, when it gets developed in the body, it will affect every other cell of the body. And all the other cells suffer because of the waywardness of this particular cancer cell. And so cancer is really an accident. And it can happen to anyone and any child at any time. And because I talk about childhood cancer now, I want to talk about children. We can always have another time to talk about adult cancer, but today we're just going to talk about childhood cancer. I think let me just enable my video. I don't know if you're able to see me. Maybe you can. Okay, you can see me. That's fine. But this is an accident that can really happen to any child. And cancer in particular is not a demon, it's not a spirit. I know we're very spiritual people here, but honestly, cancer is not a demon or a spirit that needs to be cast out. So, what is that word called? Cast out. I've forgotten the spiritual term that we use. Cast. I think it's cast out. It is not a curse. It's not like because someone cursed you, and so that's why your child has cancer. It's not a punishment for doing wrong. It is not as a result of witchcraft. It was not created by whites. So it's a disease like any other. And like we're going to see, and as Uncle Bob said, it's becoming a major problem in our society, really. Sorry. Okay, so what brings it about in most children is really unknown. And for most children, cancer is what they call sporadic. A child is there, living healthy, happy, fine, good, looking, having fun, and all of a sudden the child has cancer. There are no clear risk factors, there are no clear predictors. There's no, you can know your child is going to get it or not get it. Any child, anywhere. That's like anybody or each one of us can actually get cancer. Some cancers may be related to some infections like malaria and HIV. Some cancers may run in families. Some cancers may be due to so many things. But generally, when we see children with cancer, we really don't see any pattern. We don't see children come from poor families or good families or children come from this part of Uganda or this part of that kind of thing. Children are coming from every area, and what really causes cancer in them is really largely unknown. And any child anywhere, as I said, can get cancer. So childhood cancer is really becoming an important problem worldwide. And about 400,000 children develop cancer every year. Like 400,000 children, new children develop cancer every year. And of those, actually 85% are living in the low and middle income countries, of which Uganda is part. So, of course, that's where really most of the childhood children are being born. Most children are being born in the developing world. Actually, about 85% of the children below 18 in the world live in the low and middle income countries. It makes sense that more cancer is in the developing world, really. And you know that, for example, Uganda, half of our population is below 15. So the average Ugandan is a 15-year-old child, actually, because half of the Ugandans are below 15, which is very, very, very concerning. And so that's why you have more children in the developing world, because that's where actually children with cancer, because that's where actually children are being born. Now, Africa is actually becoming a major, childhood cancer is actually going to be largely an African child problem with time, because right now, as we speak, every one out of every 4 children with cancer in the world is actually an African, just on this continent alone. So, all the whole place, one out of every 4 children cancer in Uganda, sorry, in the world is an African. And actually, in about a few years from now, maybe around 25 years from now, half of the children with cancer in the world will be Africans. So Africa is going to become a major place where childhood cancer is going to be, partly because Africans are going to have more children than everybody else, but also partly because of so many other things that are happening in Africa, really, that actually kind of like help the whole growth and spread of cancer. Um, like I said, also Uganda is also really partly also having its fair share of childhood cancer, and about 3,200 children are estimated to develop cancer every year in Uganda. About 3,200 Ugandan children, and about 1,200 Ugandan children are diagnosed nationally every year. That is at the Uganda Cancer Institute at Mulago in Kampala, at Mbara Regional Referral Hospital and Ruhara Mission Center in Ankole Diocese in Mbara, and at Racho Hospital in Gulu. And so the other 2,000 children actually die without a diagnosis. So every year, Uganda loses 2,000 children to cancer before they are diagnosed. So all those children that we bury and we think they've died of malaria, we think they've died of typhoid, we think they've died of witchcraft, we think they've died of something else. Actually, some of those children have died of cancer, unfortunately. And we can't know, we have not known, I mean, they have not been diagnosed, unfortunately, which is a very, very serious problem. And I just wanted to show you those 4 cancer centers in Uganda, the one in Gulu, the one in Bara, and the 2 in in Kampala. Yes, also there's one in Ruharo Mission Hospital just next to Bara Regional Referral Hospital. That one mainly treats eye cancer. That's a bit different. So how does cancer look like? If someone says, I've never seen a child with cancer. So how does actually cancer in children look like? And it actually has 2 major presentations. The first one is that children with cancer generally swell. And the swelling is because the other cells are growing very, very, very much, not under the control of the body. And so they make a lump or swelling on the body. And the others are what I term as blood problems. And I'm going to go through each one of them briefly, and then we shall talk about other things. So cancer, these things can be anywhere. So cancer can literally involve every part of the body, from the head to the toe. I've literally seen cancer from every part of the body, from the head to the toe. Really, someone told me, I think maybe apart from hair and toenails and teeth, I've not seen cancer in those three, but every other part of the body, I have seen cancer there. So, and so literally cancer affects every part of the body and could affect the brain, sorry, the head. The child would get those swellings on the head and the face, and this is how the child would look like. Really, this is if I was walking on the street and I met this child on the street, I would certainly think that this child actually has cancer. Also, children may have cells of the eyes themselves that I've talked about, which is called retinoblastoma in English. And it's a whole long story. It's a whole cancer we saw, which is a little bit different and difficult. And I wish we could really even know more about it. But children also can have facial swellings, like I've said. Children can have swellings on the face. Children can have swellings on the neck. No, there could be swellings on the neck themselves. Children can have swellings in the chest, and these swellings can present those whiteness. Sorry, those whiteness, those white things are really swelling. This is an X-ray, and that white, basically, this white is not supposed to be there. This especially the upper part, and also this other one is not supposed to be there. I hope you see that. the cancer where it is. And those children would generally present with breathing difficulties. Of course, these children get to be treated as TB, they get to be treated as pneumonia, they get to be treated as asthma, and of course, finally they die because a lot of our people in the community, a lot of our primary health care workers may not actually be aware of, of, of this. So a lot of children really do die in the process. You know? And because so these cancers can also be in the back, and so they cause issues with breathing. Yesterday we had a little girl who came with cancer that has gone to her back, so she cannot use her bowels, she cannot use her urine, so her bladder, she cannot walk anymore. You know, that kind of thing, really. Also, abdomen. Abdomen is the commonest presentation of childhood cancer. It's the commonest presentation. Our experience is that most of the children that come to us in Barara is that they'll have disease in the abdomen. And this abdomen this disease will cause distension and so many other problems actually happen to this child. So these children may look like this also. They may have swellings of different sizes, swellings of different forms and types and places. Some may be big, some may be painful, some may not be painful, but they generally look like this. And also swellings of the pelvis or the gluteal region. You know, this child was born basically when it was a premature, meaning that this cancer developed when the child was still in the mother's womb. By the time this child was born, they actually had cancer, which can be very interesting. The child can get cancer utero. Also, the children can have swellings of the limbs, arm, and the legs. This is a very, very, very sad cancer because it tends to happen in adolescents, you know, child, adolescent, 16, 15-year-old, they've survived, they're now, they know each other, they know themselves. I don't know how you were when you're 16-year-old, you're there looking really nice, putting on a show, looking good, putting on what, and all of a sudden, your arm needs to be cut off, your leg needs to be cut off because of cancer. It's an extremely distressing type cancer. And also, children can actually have swellings in the brain. And these ones are very difficult to diagnose because symptoms are not obvious. They're not really out there. Children may have subtle symptoms that can actually go on for a long time before cancer is understood. Some of them would be excessive headaches. My thing that if a child keeps talking about headache, 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 that child is to be taken care of. If the child has behavior problems, if the child was performing very well in class, was becoming number one, number two, but now out of the blue, without any explanation, they are number 50, they are repeating classes, that actually can be a recipe and something. Visual problems, if the child has visual problems, can't see well, surely I'm not saying it's cancer, but it could. And I'm also not saying that all these are cancers. No. Other things that can cause this that are not necessarily cancers. But I think one of the reasons we're talking about it is because cancer is not generally identified early, and people think of other things before they think about cancer. So children may also present with other blood issues. Children may have anemia that requires them to have transfusions over and over again. A child that requires transfusion today, tomorrow another transfusion, next week you need to give more blood, the week after please give more blood. That could actually be cancer. A child that bleeds a lot through the nose, through the mouth, that keeps bleeding, that actually could be cancer. A child that has prolonged fever that does not respond to antibiotics, that could be cancer. Now, that could be so many other things, as you can only imagine. That could be so many other things. could be so many other problems, certainly, but one of them could be cancer. And so as you look for other problems that could be causing this problem, please also think about the possibility that this could actually be cancer. This is how lack of blood looks like. Basically, children tend to be whiter than normal. When you compare them with your hands, assuming that for you normal, or they tend to really look whiter and paler. And also children may bleed, as I said, repeatedly through the nose. They bleed excessively. The bleeding can't stop by itself. The bleeding is spontaneous. The child is there walking, not playing, not fighting, not falling down, but has started bleeding through the nose, through the mouth. That child could actually be having cancer. I am not saying all those children have cancer, but that is one of the ways cancer children does that. But cancer in children is really challenged by so many problems, barriers in Uganda, really. There's low awareness about this in the community, also among healthcare workers, unfortunately. That a lot of healthcare workers, unfortunately, were trained when cancer is not part of what they learn about. And so these other 2,000 children that we're talking about, they treat them from something else. Give them antibiotics, give them this, give them that. They actually never think about cancer until the child dies, actually, without anyone ever getting to know. Those who present finally, and that is really that causes delayed presentation for diagnosis. Most of the children that come to us at the cancer unit in Barara, they come late. 75% of them actually have stage 3 and stage 4, meaning that their disease in most cases is already advanced and grown and really difficult to treat, cure. So most of the children miss diagnosis, like those I told you. 2,000 children in Uganda, got time to think about it. 2,000 children in Uganda die cancer without a diagnosis. It's extremely difficult. There are low numbers of trained specialists. We are still very few. We are better off than we were 10 years ago. 10 years ago, we did not have a pediatric cancer specialist in this country. Now we have about 20 or so, which is a very, very, very good improvement. Trouble is that most of them are in Kampala. None of them wants to go to the village. Sorry, don't worry about that. But yeah, it's a very, 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 very small number. Very, very, very small number, certainly. Very, very small number. And because of poverty, people cannot go through the treatment. People start treatment, and after some time, they fall out of treatment because they cannot keep coming. Most of the time, childhood cancer treatment requires repeated visits to the hospital, repeated over and over again for many years. Just yesterday, I was writing a letter. We have a patient, a little boy called Brandon, we're treating for cancer of the blood called leukemia. His treatment takes about 3 years, 3.5 years actually, whole 3.5 years. So the discipline of the parent bring the child there every month, every month. Initially, like every week, then afterwards, every month, every month for 3.5 years is extremely difficult. So the father of Brandon in particular is in UPDF, and he was working in a nearby barracks. I don't want to talk about it so that you don't know where it is. But recently has been actually deployed to a place outside the country, in a far off place outside the country. And so because of that, it's become very difficult for them to keep up with their adherence. So yesterday, I was actually, the family asked me to write a letter to the UPDF. Yesterday, I wrote a letter to the UPDF asking them to transfer him back to a nearby post so that the son can pass his treatment, and then he can always be taken back after that. It's extremely difficult to go through monthly treatment, monthly for 3.5 years without stopping. So a lot of children along the way, a lot of families along the way, money runs out, and so they actually drop out of treatment. And obviously, when children drop out of treatment before the cancer completely goes away, the cancer comes back. Very difficult to treat cure them. And so many other challenges, really, so many. I couldn't talk about them, all of them. So many, so many, so many, so many challenges, really. As a result of that, as a result of the so many challenges that are unique to Africa and the developing world, there's so many inequalities, really, in the outcome. Whereas 80% of the children treated in the developed world survive cancer, only 20% children with cancer survive in our setting. A lot of children do die. It means that 80%, whereas we have most of the children cancer. No? We have 85% of children with cancer in the low and middle income countries. Only 20% of those 85% are the ones who cure. And the high income countries where they have only 20% of the children with cancer, sorry, 15% of the children with cancer, actually all of them, almost all of them, really do cure. This shows that childhood cancer is actually curable. Childhood cancer is actually curable. And that's what makes it different from adult cancer. Adult cancer is actually a bit more difficult to cure. You, I'm not trying to scare you, but to be honest with each other, adult cancer is a little bit more challenging to cure for so many different reasons. I'm not going to go into right now. But compared to adult cancer, childhood cancer is extremely curable. And when children don't cure, it's because someone somewhere has failed them. Either the parent did not take him to hospital early enough, or the healthcare worker did not know that this was cancer, or there was no drugs, and so the patient did not get enough treatment, or there's something happened, or there was no nurse, or there was no doctor, or something like that. In most cases, not always, but in most cases, when children die of cancer, it's because someone somewhere has failed them. In most cases, not always. So, but there's hope. Honestly, and things are getting better, to be honest with you. I do not want to paint a gloomy picture of childhood cancer. We have now two specialist training programs in the country. We have one in Mulago and now in the Uganda Cancer Institute. They're churning out specialists who are really going out to run programs. I am a beneficiary of one of them. I graduated in the Uganda Cancer Institute about 8 years ago, and I've been running the center for about the service for about 8 years now. We have about 20 specialists now trained so far, and they're big diagnostic and treatment facilities. In Bara now we're able to use very, very high-tech diagnostic methods actually to diagnose cancer and also to treat cancer. Very, very high and very, very potent treatment. We have a lot of support. We have so many people supporting us, really, and we're very, very grateful to them. We get support from Bella College of Medicine and Texas Children's Hospital. We get support from Uganda Cancer Institute. We get support from Uganda from the Ministry of Health and the hospital certainly, and from the university, and from so many people, really both local and international. We get support from Mass General Hospital in the US also, and so many other people are really coming in to help us because of the opportunity of talking to them about this and because of what God has been doing there. Most children with cancer being diagnosed. When we started the program, when I came from Kampala, we diagnosed about 40 children per year. Now we are, I think, on the course to diagnose about 150 children this year alone. We expect to be getting about 400 children per year. We expect that in the catchment area of Barra Regional Hospital, we're supposed to get about 400 children per year, but we still get about 150 children per year, which is a better an improvement, but we believe it could actually be better. More awareness campaigns are happening. More children are surviving cancer. This particular one is one of my best pictures in my laptop. On my laptop, these are 4 boys. They all survived cancer. So sometime back we had last year. This is last year's picture actually. We usually have an annual campaigning run. So it's kind of like a childhood cancer awareness and fundraising run in Barra. We had one about last week actually. Unfortunately, I wasn't there, so I didn't attend it. But this is last year. So these 4 boys actually, all of them are cured of cancer, and they're able actually to run 5 kilometers and finish them. So I'm so glad that we're able to not only cure children, but give them the capacity, by the grace of God, give them the capacity to be able to run a 5 kilometer um, track and complete it, really. So we're really, so there are more children surviving, and things are getting better. And just a few pictures to show you. This little girl came like this and went away like this, having lost her eye certainly, but certainly much better. And this boy also came with all his neck swollen and full like this, but went back with his neck totally healed. And this little girl came back all the worst possible set, condition, but I'm back smiling, happy, jolly, certainly. And this boy is an interesting little man from naturally, he's a refugee from Congo, and he has gone through 2 treatments for cancer. Initially had cancer called lymphoma, and then he developed another cancer called leukemia. And so basically went through treatment for about 5 years. And he's alive and well. He's now a little big boy, maybe about 16 years now. And he's really fine. It's one of the most wonderful success stories, which we really thank God. And receiving treatment in Uganda when you're a refugee is an extremely difficult experience. Extremely difficult, really. And in the process, in the course of his treatment, actually he lost his dad. And yes, he lost his dad actually. And so it was extremely difficult for the family and for the mother to go through the treatment alone. But look where he is now. He's a big boy, very nice looking, and it's one of the people we thank God for. So what should we do? This is the last slide I'm leaving here. I think everyone should just tell someone, and I think the whole thing is about awareness, because these children need to come early, so we can treat them. And every child with a swelling and recurrent blood transfusion and need for recurrent blood transfusion needs to be treated and needs to be screened and diagnosed. Not all these children with swellings and not all of them with recurrent blood transfusion will have cancer, but every one of them needs to be screened and diagnosed. Now, early diagnosis and adequate treatment are the only ways of controlling child cancer. I want something I didn't mention, which I think most of you actually think about, is how to prevent childhood cancer. Unfortunately, there is no way. There is no way you can stop childhood cancer from developing in a child. Like when you talk about adults and you say, stop smoking, stop taking alcohol, stop screen, go ahead, they check you. All those things are wonderful for adults, actually. But for children, nothing like that actually happens. And the only way we actually get control cancer in children is by early diagnosis and treatment, adequate treatment of that. Not only diagnosis, not only treatment, not only diagnosis, but it needs to be early, because when it's late, we cannot cure most of them. And the treatment must be adequate, because if it's adequate, then we cannot, the children will not cure certainly. So it's very important that children get to know, so that all of us get to know about this. So then, and especially if there are any health workers in this place, in this meeting, please, children with a swelling, a body mass, any body mass, not swelling of edema, but swelling of body mass, and any need for recurrent transfusions, please. If you're a health worker, my mantra is, anyway, we shall talk about that with health workers. These support hospitals, in foundations, and where, I'm reminded of this verse in Matthew chapter 25, verse 5, where Jesus said that, truly I tell you, whatever you did for, no, I think that's supposed to be, whatever you did for the least of these, you did for me. I think there's an earlier verse that talked about this one, is whatever you did not do. Sorry, I meant whatever you did. When Christ was talking about the sheep and the goat when they reach hospital, in verse 37, it says, they say, "Oh Lord, when did we see you hungry and feed you, or thirsty and give you something to drink?" When did we see a stranger and invite you in, needing clothes and clothe you in? When did we see you sick or in prison and go and visit you? And then King Jesus will reply, truly, in verse 40, supposed to be verse 40, truly I tell you, whatever you did for one of the list of these brothers and sisters of mine, you did for me. For every time we discuss, let's just not forget that actually Christianity is really about taking care of the poor. It's very possible for us to think that Christianity is just going to church and living our lives out of church. That's also very, very important. But actually, Christianity also involves going out to the marketplace, to the hospitals, and truly getting dirty with that and sitting with them, talking to them, prisons, you know. Um, Basically, I know I'm preaching the choir, I'm preaching the Pope. Sorry, I'm preaching to the Archbishop here. I know you know this better, but that's what I'm basically talking about. That every time we go out to preach and to minister these little ones, it's as good as we're doing it for the Lord. And the Lord bless us. And maybe we should start a program as Church of Uganda, hospitals. We have one in Ankole Diocese. Maybe we should have one in the main diocese, you know, archdiocese, not only for childhood cancer, but not only for all the other conditions, but also including cancer. I believe there's a lot we could do for children, both at the individual level, but also at the institutional level, so that we can reduce the pain and the suffering the children with cancer go through and the families that go through. So sometimes I'm just reminded of one of the challenges when children try to, some families, either they'll drop out of treatment because of poverty, or they'll sell everything they have in order to afford the treatment. So I think something that I just remember a mother who even they sold beds and mattresses, chairs, and basically everything that they own. People sell their land and everything, so that when the child survives or dies, they basically don't have anything. They basically lost everything, and their lives are fundamentally changed, really. And so the complications are not only in the body, but also in the mind, in the finances, in the family, and everywhere. So I'm saying this because basically people and families with cancer usually require a lot of support, and I hope that each one of us could do something. Thank you very much. Let me end there. Back to you, Uncle Bob. I hope we still have enough time to close.
Thank you, Doctor, for that time of diving deep into the pot of knowledge that you've shared with us. A lot has been learned. Thank you very much. May we put our digital hands together and thank Dr. Atwine. Doctor, thank you. There are things we see on a day-to-day basis we take for granted. And these things of sometimes we feel pains here and there. We don't care what they are. We just want to go to the doctor when they are in advanced stages. I think they have been a problem and a killer to many. Thank you very much once again, Doctor. It's been so wonderful. Ladies and gentlemen, please share your questions in the group, in the chat as we move on. Doctor, as you are presenting, I remembered while I was growing as a young boy, my home is about 35 kilometers from your hospital, from Mbarara Referral Hospital. But I used to see people either with deformed hair, faces or something, or like one ear, and would be told that these ones are cancer survivors. In my language, they call it a kokoro. And they used to say they were cured of a kokoro. And this was a time before we got these sophisticated medical solutions, high-level diagnostic systems. My question is, if it is true that these people would be locally and traditionally maybe cured, what has happened today? How come it is harder to attend to cancer cases with even better systems than it was then? Doctor, you may answer that as I get more questions.
Sorry, I was talking while muted. So, yeah, I think the question is, you saw a lot of cancer survivors, right? But you don't see them a lot these days. Sorry, is that what the question was?
Yes, yes, yes. Mm.
Oh, that's quite interesting. I think maybe if you came back to your home, you perhaps will see some of them again. That's an interesting question that I honestly don't have an answer to, and it's I don't know if maybe they were adults, because to be honest with you, I don't know where they got cancer treatment from, because cancer treatment in Western Uganda for children started in 1997, and mainly treated just a few. They treated few cancers, and most of them were referred to Mulago. Adult cancer treatment started in 2014 in Mulago, in Barara, and before that, almost everyone who developed cancer in Barara either died or went to Mulago. So I honestly don't have an answer to that question, and I hope that you'll be able to see more cancer survivors.
Okay. Thank you, Doctor, for that. And your microphone seems to be, I don't know if you're using a headset, seems to be cutting the volume. It is kind of intermittent. I have a question from UK here. It is talking about diet. Does diet play a role in cancer? There have been many stories of how what we eat sometimes can boost chances of getting cancer. And if so, does this relate to children? If so, what food should stay away from what the children should consume?
So, so, so yes, maybe I removed that slide from the presentation just before I started the presentation. Just kind of comparing adult cancer and childhood cancer. I thought it was I was trying to shorten the presentation really. So childhood cancer and adult cancer are really fundamentally different. And the adult cancer process really takes time. It's a very slow growing process. If you get an adult right now diagnosed, for example, prostate cancer, most of the time, this process has been going on from between 5 and 10 years, most of the time. So by the time you get cancer in an adult like today, that means that for the last 5 or 10 years, this person has actually been developing this cancer. And that's why if you're able to grab it in those 5 years, you're able to prevent the cancer from growing. Because usually adult cancer has warning signs. So warning sign, warning signs, warning signs, warning signs, warning signs. It keeps warning you, I'm coming, I'm coming, I'm coming, I'm coming, I'm coming. And if you actually get it when it's still warning, then actually it can prevent it from actually becoming cancer. The same thing with cervical cancer, the same thing with breast cancer. You know, there's a warning period, a time when the process is starting and just warning you. And that's usually, that is because, and that's really the normal, kind of like the normal process of cancer development. It's supposed to be slow and supposed to grow to kind of like warn you like that. And usually it is due to certain conditions, say food, especially obesity, and 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 and, um, and certain other age, for example, certain infections, certain hormones, and things like that. But childhood cancer is different. It won't really give you warning. And secondly, it really does not have any specific risk factor. When the children receive, really, they are not obese, they are not malnourished, they're just like any other normal child. They don't have any specific risk factors. So food in particular also does not actually predict cancer in children. It may have some of that in adults, but children, no, not yet. At least not children in Uganda. No, no, no. We don't have anything. And that's why I say that basically there's really no way to like seriously to prevent childhood cancer in the community, really. Like there's really no way you can prevent child cancer by changing the diet or by doing anything really. Sometimes we really try to look for a cause and a blame, something to blame. So if I get an accident, then who is to blame? If I get malaria, so what's the problem? So the whole trying to look for something to blame is part of a grieving process because it helps us to say, oh, the child got cancer because of A, B, C, D, and maybe someone to blame. It's a grieving process actually. It's called blame. But certainly it does not really work for childhood cancer. Most childhood cancer is sporadic, they call it sporadic, and it just happens on accidents. It's just misfortune, so to speak, just misfortune. The child is very unfortunate that he developed cancer and his body was not able to deal with it immediately, like was not able to move it up because the body is supposed to realize that you have your cancer, your body has developed cancer and supposed to move it up immediately. But for this particular child, those two things happen at the same time. One, the child developed a cancer cell. Two, the body was not able to move it up. And the cause of that is really just not understood why this child's body is not able to move it up and then this child's body is able to.
Doctor, I seem to have dropped.
But no, I'm on. I'm on. I can hear. I finished.
Okay. Yes. Okay. Thank you. Thank you, doctor. There is another question here. One of us here has a relative who was diagnosed with cancer, tested positive. Instead of heading to the hospital, he went into the upper room and started praying. And after days of prayer, went back and was tested negative. He was a doctor and a very good committed Christian. What do you say about that? And maybe are there any other cases of such a nature you have witnessed where people resort to spiritual healing rather than the medical intervention?
That's a very interesting question, yeah, certainly God can heal anything, certainly, and He has healed anything. I can say that I've personally experienced that. But also, what I've experienced is that sometimes a child can initially be thought to have cancer, and then we usually test twice. Whenever children have suspected of cancer, we test them twice. So we test them the first time, and when they say it's not cancer, and also we feel it's not cancer, then we say, okay, that's not cancer. But when we think it is, when the cancer results come and they're positive for cancer, almost always we test another time to confirm that's cancer and also to be very, very sure of the type of cancer. And sometimes you find the first test said it is cancer, and the second test said no, it's not cancer. For some reason. And I'm not disputing this person's story because certainly Christ can do it. God can heal any disease, really. I personally feel that there are two things about this. One is that if honestly you pray and God heals you, I will be very, very happy for you, to be honest with you. I would rejoice certainly for you and I'll be very, very glad. But also I've seen certain people who do the same thing and then the cancer doesn't go away. I think right now, we're dealing with a family that has gone through the same problem. The little girl, her name starts with P, got cancer sometime back, and they were very strong Christians at All Saints Church in Barara. And they actually preferred they came, we diagnosed them, started on treatment, the child became fine. But shortly after starting treatment, of course, then they went and started to pray. So unfortunately, I think there was a disagreement. The father wanted to continue praying, the mothers wanted to continue treatment. And because of that, the disagreement, certainly, their marriage, their relationship has actually been very, very seriously affected. But then after a few months, certainly the child came back with the cancer symptoms. So I honestly think God can heal, certainly. I also believe that, but when a person comes to me to the hospital with disease, I offer them medicine. To be honest with you, I do not offer them um, uh, spiritual healing, because if they wanted spiritual healing, they would go to the hospital. So I'm sorry, they'll go to church or pastor, something like that. So that's okay. So it's not something that I honestly offer. I pray with them for God to go through, to support them and strengthen them through that treatment process. Because when they've come to me, I believe they've come to me for medical care and not for spiritual care. But I support them spiritually and for God to, because you still need God through that treatment process, really. And so I do not suddenly dispute spiritual healing, miracle healing. It happens, certainly. But I've also seen instances where the people believe for it, but it didn't happen. So I think it really depends on your conviction and how much God has spoken to you through things. With time, I've learned that faith does not mean getting God to do what you want, but believe in God for what He wants to do for you. You know, that kind of thing. That's kind of like faith will not necessarily pull God's arm to do what He doesn't want to do for you, but faith will make you believe that this is what God wants to do for you. So if you're honestly convicted and assured that God has spoken to you, He's going to heal you spiritually, which I think is possible, miraculously, which I think is possible, then you should really be. Faith requires that you believe and trust that God is going to do it for you. If you've not really gotten that really serious conviction about that, I suggest that you come for medical treatment and you pray, and God will still support you and heal you and carry you through that very, very difficult treatment.
Oh, thank you very much, Doctor. The last question, and this is general, not necessarily to children alone, and actually it refers more to the adults. There are cases where people have been diagnosed with cancer, and knowing the stories around cancer and the treatment costs, as you already mentioned, it is an expensive journey to go through. Some opt that, no, leave me until that day when I will breathe my last, instead of wasting family resources. How would we as Christians, and specifically those who are listening in and those who will listen in later to the recording, be able to support and help these people and change their minds probably to seek support, other than leaving it until the day they breathe their last? It's like self-suicide.
Yeah, that's a very, very important question. And it's a very painful thing, actually. And I've seen it a lot. And it just comes back to poverty and people not being able to afford treatment. And to be honest with you, I would approach that from two levels, depending on how the cancer is, how far the cancer has gone. I think if the cancer is very advanced, and because again, I've also seen people being sent to India when everyone knows that even in India, I've seen people being sent to the US. I mean, when everyone knows that even in the US, no one really treats that type of cancer, that kind of thing, because that's the flip side. Because sometimes people also again go an extra mile. One actually is, from science and from experience, there's really no hope for that patient. And yet I've also seen patients who could potentially cure, but they can't cure because they don't have resources. So I think for me, I'd approach it from two ways. How advanced the type of cancer. There are cancers that are really difficult to cure in adults. Very, very difficult. Stomach cancer, for example, most of the time, by the time you get symptomatic, you're not curable anymore. But there are some cancers that can cure, like breast cancer, like colon cancer. So it depends on the type of cancer, and also depends on the, how advanced it is. And so if I think I have a patient who thinks they need to rest and not bother so much, which actually is their real, is they have a right to decide like that. If they choose to do that, then I would talk to them regarding that. If I think the cancer is really advanced, I would give them symptomatic relief and offer them end of life care, and then they would rest in peace. If the cancer is still young and I think there's potential for cure, I would honestly convince them against cure and treatment, and look for support for them and look for everything for them. But ultimately, it will depend on the person himself and sometimes the family. I think something back I had an old man, a poor old man who had prostate cancer, and the family even decided not to tell him. And actually, one of them was a doctor himself. He said, "No, no, no, we don't tell him. We want him to die in peace." And the man was not exactly a very, very old man, like over in his 90s. He was like in his 80s or something, or 70s even, you know. And of course, the man died, really. I just feel sad because I think there was a possibility that they could have given some treatment to have prolonged him some time. So it really depends on, I don't think there's like a, 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 um, an answer for every circumstance. Usually it depends on what exactly is happening in this particular situation, and what can we really do about it. Whether there is any treatment, whether it's a disease that there's no treatment in Uganda for it. I honestly don't think, and a family suddenly cannot afford to go to India or to the US or UK, whatever, Turkey. Sometimes I think it's good for them to accept to have end of life care. If it's something that we have treatment in Uganda, I think I'll do my best to make sure that this patient really gets care as much as they can accept that.
Thank you very much, Doctor. It's been an honor having you. I will invite, is Daisy still on call? Oh, she seems to have dropped. Okay, thank you. It's been an honor having you and having listened to this wealth of knowledge. This is what people pay for dollars and dollars to go and listen to, but God has brought you to us and we have had this for free and we thank God. At this very moment, I will request Reverend Hosea to pray for us and give us a blessing.